This is why you should always sleep on the left side of the bed. Have you ever thought about which side of the bed you sleep on and if it really matters? Well, it turns out that picking the left side could do more for you than just give you an easy way to reach the nightstand. It's not just about comfort, it's about using the natural forces of gravity to enhance your body's ability to function at its best while you rest. This simple habit could lead to significant health improvements, from better digestion and heart health to enhanced detoxification and quieter nights free from snoring. But how exactly does sleeping on the left side of the bed impact our health? In today's video, we have explained just that. Also, stick to the end of the video, where we will talk about 10 foods that may help you get sound sleep. Now, let's get started. 1. Enhances digestive efficiency. Sleeping on the left side of the bed may significantly enhance digestive efficiency, a concept that might seem simple but is deeply rooted in the anatomy and gravity's influence on our body's natural processes. The stomach curves naturally towards the small intestine. When you sleep on your left, this curvature positions the stomach in a perfect downhill trajectory to the intestine. This means gravity may help move the digestive contents along, preventing issues such as heartburn or gastroesophageal reflux. These conditions often arise when the stomach's acidic contents flow back towards the esophagus. It is more likely when lying on your right side because, in that position, the stomach sits higher than the esophagus. Additionally, the pancreas, which secretes important digestive enzymes, is located slightly behind the stomach. Sleeping on the left side of the bed may allow enzymes and other digestive secretions to flow freely and reach the food in the digestive tract more efficiently. This not only speeds up digestion but also helps the body process nutrients and waste more effectively. Moreover, the small intestine's connection to the ascending colon carries waste to be expelled from the body. Sleeping on the left therefore supports the natural trajectory of waste moving through the bowels. This may enhance your bowel regularity and reduce the likelihood of constipation. A 2010 study of 10 participants found a relationship between laying on the right side and increased cases of heartburn, also known as GERD, than when laying on the left side. Researchers theorize that if we lie on the left side, the stomach and its gastric juices remain lower than the esophagus while we sleep. 2. Improves heart health. This sleeping position enhances the heart's ability to pump blood more efficiently. Specifically, it helps with the process of venous return, which is the movement of blood back to the heart. When lying on the left of the bed, the heart is positioned such that it may pump blood downward, using gravity to its advantage, thereby reducing the effort required to send blood through the body. This gravitational support may also aid the aorta, the main artery that carries oxygen-rich blood from the heart to the rest of the body, as it arches from the top of the heart down to the abdomen on the left side. Sleeping on the left side of the bed aligns with the natural direction of the aorta, allowing for smoother blood flow with less strain on the heart muscle. This optimal positioning may help lower the workload on the heart, making it easier for this vital organ to function without extra stress. However, according to studies, patients with congestive heart failure often avoid sleeping on their left side naturally. This might be a protective measure to prevent discomfort from the noticeable heartbeat due to an enlarged heart or to avoid additional strain on their heart and circulation. 3. Facilitates lymphatic drainage. The lymphatic system, unlike the cardiovascular system, does not have a pump like the heart to move its fluid, known as lymph, throughout the body. Instead, it relies on muscle movement and other external forces to circulate. This is where the role of gravity and body positioning, particularly during sleep, becomes pivotal. The majority of the body's lymphatic system is situated to drain towards the left side. This means that when you sleep on your left side, gravity may help facilitate the movement of lymph through its pathways more efficiently. Lymph carries waste products and toxins away from the tissues and into the bloodstream, from where they are processed by the liver and kidneys or removed from the body. Enhancing this process helps the body detoxify more effectively, reducing the workload on organs like the liver and kidneys and improving overall health. Moreover, the thoracic duct, which is the largest lymphatic vessel in the body, also empties into the left side of the heart. When sleeping on the left side, this duct is supported by gravity, allowing it to drain more freely and efficiently. This position may help accelerate the removal of lymphatic waste from the lower half of the body up towards the heart. The faster and more freely the lymph may flow, the better it may transport immune cells throughout the body and improve the immune response. Additionally, efficient lymphatic drainage may also reduce the risk of lymphedema, a condition characterized by swelling in an arm or leg caused by a lymphatic system blockage. By promoting better lymph flow, left-side sleeping may help prevent the accumulation of lymph fluid in the extremities, which may contribute to swelling and discomfort. 4. Prevents snoring. The position in which you sleep may significantly influence how much your airway is obstructed. When you sleep on your back, gravity pulls the tongue and soft tissues of the throat downward, which may block the airway and exacerbate snoring. However, when you sleep on your left side of the bed, the effect of gravity on these tissues is different. This position may help keep the tongue and other soft tissues in a more neutral position, away from the back of the throat, which reduces the likelihood of them creating an obstruction. Additionally, the left side sleeping position may also improve overall airway alignment. This better alignment may reduce the narrowing of the airway that triggers the snoring sound. For individuals with conditions like sleep apnea, where breathing stops and starts intermittently throughout the night due to blocked airways, left-side sleeping may be particularly beneficial. It not only may help in reducing snoring but also in minimizing the occurrence of breathing pauses. Studies found that in most cases, the combination of weight loss, sleeping on one side, and the administration of a nasal decongestant significantly reduces the frequency of snoring in asymptomatic men who snore heavily. 5. Improves sleep apnea. The mechanics of how left-side sleeping aids in reducing sleep apnea symptoms relate closely to the structure and positioning of the airway during sleep. When someone sleeps on their back, gravity may cause the tongue and other soft tissues in the throat to fall back, narrowing or blocking the airway and triggering apnea events. This position may exacerbate the severity and frequency of obstructions. In contrast, sleeping on the left side may help maintain a more open airway. The improved alignment of the head, neck, and spine on the left side helps maintain better opening of the respiratory tract, thereby reducing the likelihood of obstruction and subsequent apnea events. Additionally, left-side sleeping may enhance overall cardiovascular health due to better circulation and reduced heart strain, as previously discussed. Improved heart function is critical for individuals with sleep apnea, who are at a higher risk of cardiovascular problems. By facilitating smoother blood flow and reducing the workload on the heart during sleep, the left-side sleeping position may indirectly support the management of sleep apnea symptoms by fostering a healthier cardiovascular system. This position also tends to promote more stable and deeper sleep cycles, which are often disrupted in individuals with sleep apnea. By reducing the frequency and intensity of breathing interruptions, left-side sleeping helps achieve longer periods of uninterrupted sleep, which is crucial for the physical restoration and mental health benefits derived from sleep. According to a study, people who preferred sleeping on their backs had slightly more awakenings during the night compared to those who preferred sleeping on their left side. Why you should not sleep on the right side of the bed. 1. May increase pressure on the liver. Sleeping on the right side of the bed may inadvertently increase pressure on the liver, and understanding why involves a look at basic human anatomy and the liver's role in our health. The liver is one of the largest organs in the body and is situated on the right side of the abdominal cavity. It plays a crucial role in numerous bodily functions, including detoxification, metabolizing nutrients, and processing medications and toxins. When you sleep on your right side, the liver is pressed against the ribcage, which may constrain the organ. This pressure may be mild but sustained over hours each night, potentially impacting the liver's ability to perform optimally. Unlike other less sensitive organs, the liver's function is heavily dependent on good blood circulation. Squeezing or pressing on it may hinder blood flow within the organ, affecting its ability to process substances and potentially leading to a backlog of toxins in the body. Additionally, impaired liver function due to constricted blood flow may result in slower metabolism of fats, which is one of the liver's key roles. Over time, this may lead to an accumulation of fat within the liver itself, a condition known as fatty liver disease. Furthermore, the inhibited detoxification process may increase the toxicity in the blood, leading to higher oxidative stress throughout the body. This oxidative stress is a key factor in the aging process and may contribute to the development of various chronic diseases, including cardiovascular diseases and type 2 diabetes. The liver also plays a significant role in regulating blood sugar levels by converting excess glucose into glycogen for storage. A compromised liver function from prolonged right-side sleeping may disrupt this delicate balance, potentially exacerbating or leading to the onset of metabolic issues like insulin resistance. 2. Potentially worsening varicose veins. Weakening valves and veins in the legs are the main causes of varicose veins. Normally, the veins keep blood flowing upward toward the heart, but when these valves become weakened or damaged, blood may collect in the veins rather than continuing toward the heart. This pooling of blood results in the veins becoming enlarged and varicose. The impact of sleeping on the right side relates to how body positioning may affect circulation in the veins. When you lie on your right side, there is more pressure placed on the veins in the right part of the body, particularly those in the lower limbs, where varicose veins commonly develop. This increased pressure may exacerbate the pooling of blood in these veins, making it harder for the blood to flow upward against gravity. This strain not only makes the veins more pronounced but also increases the discomfort, like throbbing, swelling, and a heavy sensation in the legs. Moreover, for those who already have compromised circulation or existing varicose veins, the additional pressure from lying on the right side for prolonged periods during sleep may lead to further damage to the vein valves, worsening the condition. This may increase the risk of complications associated with varicose veins, such as skin ulcers, bleeding, and venous eczema, which may significantly impact overall skin health and increase discomfort. 3. Aggravates acid reflux and heartburn. Acid reflux, also known as gastroesophageal reflux disease or GERD, occurs when stomach acid or occasionally stomach content flows back into your esophagus, the tube that connects your mouth to your stomach. This backwash reflux may irritate the lining of your esophagus, causing heartburn and other symptoms. The stomach is connected to the esophagus at a slight angle, with the connection on the right side leading down into the stomach. When you sleep on your right side, the lower esophageal sphincter, or LES, a ring-like muscle that acts as a gate between the esophagus and stomach, positions itself in such a way that it makes it easier for the stomach acids to escape into the esophagus. This is because lying on the right side places the stomach in a higher position, thereby utilizing gravity to facilitate the reflux of acid and other gastric contents back up into the esophagus. The frequent exposure of the esophageal lining to stomach acid may lead to a number of problems. At first, it might just give you heartburn, but over time, repeated exposure may damage the lining, which can lead to problems like esophagitis, inflammation, strictures, narrowing of the esophagus, and even Barrett's esophagus, a condition where the cells lining the esophagus change into cells more like the cells lining the intestines, which greatly raises the risk of esophageal cancer. 4. Exacerbates circulation issues in pregnant women. When a pregnant woman sleeps on her right side, the weight of the uterus may compress the large vein, reducing its ability to efficiently return blood to the heart. This compression may hinder blood flow, leading to decreased circulation, which not only affects the mother but also the baby. Reduced blood flow means that less oxygen and fewer nutrients are delivered to the placenta, potentially impacting fetal development and growth. Moreover, poor circulation may lead to various uncomfortable symptoms for the mother, including swelling in the legs, ankles, and feet, as well as hemorrhoids and varicose veins. These are common during pregnancy due to increased blood volume and changes in blood pressure. However, compression of the inferior vena cava may exacerbate these issues, making them more severe. Here are 10 foods you can eat to promote sleep. Certain foods may significantly improve the quality of sleep due to their nutritional content, which includes essential amino acids, vitamins, minerals, and other compounds that help regulate sleep patterns. 1. Cherries. Cherries are one of the few natural foods that contain melatonin, which helps regulate your sleep-wake cycle. A small glass, about 8 ounces of cherry juice, or a handful of fresh cherries consumed daily, particularly 30 minutes to an hour before bedtime, may enhance sleep quality. 2. Almonds. Rich in magnesium and tryptophan, almonds help reduce muscle and nerve function while stabilizing heart rhythm. A daily intake of a small handful, about 1 ounce or 23 nuts of almonds, is beneficial for promoting better sleep. 3. Walnuts. Walnuts are a good source of tryptophan and also contain omega-3 fatty acids that help produce serotonin. A daily handful of walnuts, about 1 ounce or 7 whole nuts, may aid in improving sleep quality. 4. Kiwi. Kiwis are rich in serotonin and antioxidants like vitamin C and carotenoids, which may help regulate sleep. Eating 1 to 2 kiwi fruits an hour before bedtime may significantly aid sleep onset and duration. 5. Fatty fish. Salmon, trout, and mackerel are high in omega-3 fatty acids and vitamin D, which aid in the production of serotonin. Eating 3 to 4 ounces of fatty fish at least 2 to 3 times a week may enhance sleep quality by improving serotonin levels. 6. White rice. White rice has a high glycemic index, which may help shorten the time it takes to fall asleep, especially when consumed in moderate amounts, up to 1 cup cooked, as part of dinner 3 to 4 hours before bed. 7. Turkey. Turkey is well known for its high levels of tryptophan, which helps produce sleep-promoting serotonin and melatonin. Consuming 2 to 3 ounces of turkey during the evening meal may leverage its benefits for better sleep. 8. Bananas. Bananas not only provide potassium and magnesium, which are natural muscle relaxants, but they are also a good source of vitamin B6, which is necessary for melatonin production. 1 medium banana per day may help increase overall sleep quality. 9. Oatmeal. Oatmeal contains complex carbohydrates that may help raise insulin levels and aid melatonin production, facilitating a faster onset of sleep. A small bowl, about ½ cup of dry oats, or 1 cup cooked, consumed in the evening may be effective. 10. Dairy products. Milk, yogurt, and cheese are high in calcium, which helps the brain use tryptophan to manufacture melatonin and regulates muscle movements to prevent disturbances like leg cramps at night. Including 1 to 2 servings of dairy daily may promote better sleep. Choosing to sleep on the left side of the bed isn't just a preference, it's a strategic decision that may enhance bodily functions and improve overall health. Making this simple change in your sleeping habits could have a profound impact on your health and quality of life. So, the next time you jump into bed, remember that the left side is the right choice for well-being. Now that we have discussed the many reasons why you should sleep on the left side of the bed, let's dive into other topics of interest. Interested in knowing more about health secrets? Watch 12 bad daily habits that are destroying your kidneys. You may also try our video on what happens to your body when you have fatty liver disease. Go ahead, click one. Or, better yet, watch both and learn more about your body. Which side of the bed is your favorite? Let us know in the comments below.